Hello, hello, hello. This is Women History Month. Happy Women History Month, women. And it's time for us to celebrate our achievements, our goals, and our everyday history makers. And I have one such, a very accomplished doctor, and she's here to enlighten us with some new things and so pay attention to the entire interview, and we are so excited to have her on our show. It has been an undertaking to get this appointment because she's extremely busy. So over to you. Tell us all about it. Tell us who you are and what you do.
Absolutely. Thank you so much for having me. And so my name is Dr. Sirisha Vadali, and I'm a cardiologist based out of Scottsdale, Arizona. And I focus on women's heart health along with cardiometabolic health, for which I do run a cardiometabolic clinic here. And it's been really wonderful to get this up and running, and it's a hot topic that everybody wants to hear about.
And I'm wearing red. So that's
Yes, you are. Thanks.
yeah, you don't know how many times that, you could be at a health fair, or you could be on a health truck, or you'd be at a screening and you find that the doctors are telling you, pay attention. And many people just don't. They just continue on with what they're doing. Even if you have a primary practitioner and the doctor is telling you your blood pressure is high, your numbers are high, and you're still not doing anything about it. But doctor, let me tell you, I and my husband went on a complete health diet and exercise, and we started doing supplements and things like that. But we were able to bring our blood pressure down to a teenager level, and
Wow.
I was able to run after 8 years. So I'm
That's
telling
amazing.
everybody how easy it is to take
Oh,
care of your health.
that's incredible.
Yes.
I mean, you should give yourself a round of applause. That's hard to do, and it takes a lot of dedication. So good job and congratulations.
Took 2 years. It didn't
Wow.
come. It didn't come like over. We woke up and it's a whole process.
Yeah,
So
yeah, it's a lifestyle change completely.
so let's really dive into it. So what are the early warning signs? When does a woman? I know it can happen to any age. So you young women who look at us and say, it can happen to any woman at any age. Why are women at risk? First of all, that's the big one.
Yeah, so and you're totally right. So I think there's this misconception that mostly older women get affected with heart disease, and that's absolutely not true. So I see young women all the time with cardiovascular disease, and a lot of this is a combination between genetic factors and environmental factors. And so my theory is that if you can do everything you can to control the environmental factors around you, the lifestyle, the genetic you can't really modify. Your genetics are who they are, so that's one piece of the puzzle. But if you can really get into the nitty gritty, also checking stuff, so understanding what your cardiovascular risk is very important for younger women, especially if you have a family history of heart problems, or you start to see that in your daily checkups, you're seeing your blood pressures growing up a little bit, you're getting tired in the afternoon more than you should be for 8 hours of sleep. I think women are just go, go, go all the time. Like, and we take care of everybody, we take care of the family, we put ourselves on the back burner, and that's why things get delayed. And maybe we have this misconception that we discover it later. Maybe it was happening early on all along, you know?
Yeah, it's true. And it is happening all along because you need to be in touch with you. Yesterday, we were talking to a yoga teacher, and I used to teach yoga many, many years ago, and I've
Wow.
not done yoga for God knows how long. But we were really talking about your toes, your fingers, and sometimes you could just be in the office just exercising, and how it could just take 10 minutes or 5 minutes, but it's so important.
So
And
important.
really need to understand this because you really don't want to get a stroke or lose life because of not looking after yourself. I mean, it would be different if there was a circumstance where it was beyond your control, but you can control this. You can
Yes,
be in charge. So,
yes.
give us some tips and advice. How can someone take charge of their health, even if you're not at risk? Take care of your heart.
100%. So, when it comes to guideline recommended therapy, they're so simple. It's so simple. All we ask for is 3 times a week, 20 minutes of a moderate intensity aerobic activity, whether that's a jog, a light brisk walk, whatever you can do to get your heart rate up a little bit. And then if you could do that 2 to 3 times a week, if you want to add a layer to that, for me with metabolic health, strength training is the ideal way so that you can build that muscle, that metabolically active tissue. And so that when you do eat anything, it feeds that muscle. And so you are able to eat a healthy diet. You can have, more calories, you feel more energetic. And then lastly, really being in tune with signals that your body might be giving you. Like, are you craving a little bit of sugar more than you did in the afternoon? Or are you feeling like you're not getting sleep quite right? You're feeling like your heart rate's jumping up and down for no reason. These are all signals that you need to maybe take a step back and get some labs done by your primary care doctor or your cardiologist. And then we can kind of take a deeper dive into what's happening.
Yes, and your A1C is every 3 months. So, try and get it done. Like, I know the insurance will only cover once a year for some people, but I look for health screenings. I look for, clinical events going on, and every city will have at least 4 to 5 screenings a year. Go take advantage. Those are free. And at least you can keep track of how good your health is. You really have no excuse to say that you didn't know that. Take a blood test if you can do it daily, or often.
Yeah.
Uh, Monitor your blood pressure.
So
Keep
that's an excellent
tracking
point.
diary. Write what you eat. Pay attention to what your body is telling you. Yes.
100%. That's an
So
excellent point. The free health screenings are severely underutilized. And the
yeah,
problem is if you don't utilize them, then they get cut off for funding. So everybody should utilize those free health screenings in your area, just looking them up. And then yeah, so if you don't want to do A1C because insurance won't cover it, there's a glucose monitors that you can buy that give you kind of what your glucose is doing after you eat a certain meal. So it gives you an idea, hey, I had this thing, I thought it was healthy, but my blood sugar spiked significantly after that. And it varies from person to person. So your blood sugar might spike after a piece of
yes,
strawberries versus mine might not, and vice versa. And you just never know. Strawberries are considered healthy, So it's eye-opening for sure.
yeah,
Yeah.
true. So tell me a little bit more about, thyroids. This is a common thing for women, and many women go unchecked. The other one is inflation, but you might know better ones that are clear indications that you got to really, it's like when you drive in a traffic and there's the yellow light is going, warning you, warning you, warning you, and then the red light says stop, So what are some of the early indications that really?
So thyroid is something that is always checked before we go down any other diagnosis rabbit hole because thyroid can play any variety of form of cardiovascular health. So it can cause heart failure like symptoms, heart rhythm problems. It can cause lipid disorders. So knowing that in and out of thyroid, checking that first is always key for getting that evaluated. And then when it comes to inflammation, you should ask for something called a high sensitivity CRP. It's an acute inflammation marker. I don't want people to take it with, saying that it's high and that everything is doomed because it can go high and low based on if you got like a viral illness or something like that. But if it's chronically elevated, that's suggesting that there's something going on in the heart and we should check that out. So that's important to know. And then there's other markers such as insulin resistance pathways that you can check for, along with advanced cholesterol particle testing that are genetically mediated. And that all puts your risk into perspective.
Yeah, very true.
Mhm.
And always pay attention to your organs, your body parts. See that everything's working, functioning. It's like taking a tune up on your car. just check, is your gut working? Are you having regular, bowel movements? Very simple things. Talk to your body, talk to yourself,
Yeah.
and you'll be able to be your best advocate. The other thing is that a lot of women are very fearful, especially as you get older and you go see doctors and you do these tests and you are diagnosed with things that you have to start paying attention to. So we don't want you to panic, man. Don't get upset about a diagnostics. This is how doctors are able to check you out. So what are some of the things I would say is that immediately start taking care of your health? Start, getting on a routine. Watch a channel like mine, watch videos, be informed. So once somebody is diagnosed for a risk for heart, what should they be doing? Not panic. Don't panic. It'll just drive your
No.
blood pressure up.
Yeah,
Yeah,
and you're totally right. I think there's this fear of like, I just don't want to know. I just
yeah.
don't want to know what it is. Like, I know dad had a lot of stuff. And it takes almost like a scary event for someone to come into my office sometimes where they put it off, put it off, put it off, and then they like, felt something off and then they were like, okay, it's time to get checked out. And I really wish people would just come under the proactive nature where they're like, listen, I have a family history. I know that I just need all these tests early on and just tell me what it is. And I need to know because the thing is if I know early, we can start screening early, we can start preventing disease. And that's what the whole clinic that I run is about. So there's something called a coronary calcium score. It's a CT scan of the heart arteries themselves and it displays all the arteries beautifully for me. If you have a strong family history of a heart attack or stroke, this is a good test for someone that's like 60-ish that, wants to just see if there's plaque building up in their heart arteries. And we can also screen their carotid arteries, which is great.
So tell me more about your clinic. Where is it? And is there an online component, or do they have to come in to see you? How does it?
Yeah, so unfortunately, no online component right now. It's all in person. We're based out of the Scottsdale, Arizona area. We have 4 locations. I run a cardiometabolic clinic mo 2 of the days. And in the cardiometabolic clinic, what we do is we try to help them reduce their risk of a heart attack, stroke, and death through multiple avenues. And we do diet, exercise, coaching as well. And our patients do really, really well because we're not a weight loss clinic. So we just do it in the best way for the patient. It's very precision based, tailored therapy so that they get the best lifestyle changes out of it. And they tend to do well. People really like it.
Wow, that sounds amazing.
Yeah.
Uh, so is there a book coming up about, or is there a
Yeah.
podcast in you, or
I
we?
think so. I think we got to figure out something in the cardiometabolic longevity space. I think I'm starting to write a few things, jotting down a few thoughts, and I have a colleague that's helping me with it. And I think more to come on that, but definitely in the future.
Yeah, yeah, there you have it. So that's wonderful. We also do a men's event in June, so I'd love to
Oh,
talk a little bit about men's health. But right now, women, take care of yourself. You take care of your families, you take care of your children, you take care of everyone, your church, everyone around you, but take care of yourself. You are very, very important. So, on that note, I'll end this interview. Do you have any more questions, or would you like to say some last minute comments?
no, I just really appreciate you like taking me on. If anyone needs any more like cardiology advice, I do like a weekly series on my Instagram at Vadali MD, and just they're quick snippets, but they tend to help some patients just get a better understanding of cardiovascular health. So that's where you can find me.
So follow her, go on Instagram and check it out. Thank you for watching Discover Brightside.